Well, listen, it has not been easy to run a business the past couple of years, let alone trying to open a new business in this world. But that has not stopped Jacqueline from opening up 4th Avenue Medical Aesthetics here in Hamilton. Great to see you again.
You as well. Good morning.
Good morning to you. Yeah, because you've been in this industry for how long now?
So it's been about 5.5 years.
5.5 years, because you had another spot on Upper James. We visited that a couple of years back before all this started. But this is the new space, and congratulations on opening a new space. This is just your new baby?
It is my new baby.
Right. What has gone into opening up your own personal care space?
Well, it's been a lot of work. Actually, we just decided to go from Upper James. This is a better location, a lot more airy. So
quickly, we should say where you are. So we're on Stone Church.
We are.
Stone Church Road East.
Yes.
Okay, kind of the border of Hamilton and Stony Creek. Has the business model changed at all when it comes to personal care?
With us, no, specifically. Reason why I opened this up years ago is because I used to go into cosmetics and get things done. I'd come in to get something addressed. I'd sit in a chair and somebody would sit there and point 7 things out on my face that needed to be fixed when I only saw one. So that was a little concerning for me, and at the end of the day, I went home upset, and then of course, looking in the reflection of the mirror, I had issues with what I saw now because they pointed all these things out. Yeah. So then I decided to open this up so we didn't run into those issues. So when clients come in to get something done, then they feel refreshed, and we just address the issue at hand.
The key word in your title too is 4th Avenue Medical Aesthetics, because there is medical procedures that you're actually doing in here too?
There is. So on top of the cosmetic procedures that we do, because cosmetics has become so overwhelmed and so normal these days, is that we do medical procedures as well. So we do Botox for TMJ, for jaw clenching, we do migraine therapy, we do a lot of other things besides cosmetic.
What's Stephanie doing for us right now in this room with Alex?
So Stephanie is doing the jelly facial with the LED light for one of our clients. So she's just applying the jelly facial now. So she can explain what the jelly facial does and how it works. So, the benefits.
So it has, actually Stephanie doesn't have a mic, so we can't get her to totally explain that, but there's going to be a light that goes over top of Alex here? There
is. So we do have a light system that goes over top of this facial, so it does address things like pigmentation, wrinkles, acne, bacteria on the skin, and of course hydration.
What has the pandemic done for personal care? Because we're sitting in front of screens all the time and we're looking at ourselves all the time.
We are, and I think there's different platforms of social media. It's become very overwhelming and very influential, which is another piece. So I'm finding a lot of women are coming in and feel very disheartened about themselves, and men as well. So I think we're always trying to get to a piece of perfection nowadays because of social media. And it's very, very disheartening, and I see it with a lot of people that come in. So the difference is what we're trying to do is just address issues that they see. If they're appropriate medically, we will fix them. Realistically, what we're trying to do here is making sure that when they have a reflection in the mirror, they're not trying to be perfect, not trying to be that social media. They just feel confident in themselves, and we address the issues.
And is that the key why you kind of think that you set yourself apart from others?
100%. So when clients come in, the worst thing that's ever asked to me is, what do you think? I never answer the question. I ask them, what is the problem? What is the concern, and what is bothering them? Then we address those issues. I never point anything up, and nor will we sell anything to anybody.
Good, okay. We're gonna do a few of the treatments that you have.
Yep.
We're gonna do some Botox. What are you gonna do to me?
So we're gonna do radio frequency body contouring. So skin tightening. So that's a big piece, beach weather ready. So we're trying to decrease cellulite, tighten things up, decrease subcutaneous tissue, and get everybody ready for that beach. So we're going to do that as well.
All right, we'll do that too when we come back to 4th Avenue Medical Aesthetics in Hamilton that is open for business on Morning Live. Well, good morning, everybody. Welcome back to 4th Avenue Medical Aesthetics in Hamilton. And the keyword in the title actually is medical, as we talked about to Jacqueline in the first segment, who is the owner of this wonderful space. Because what are we doing, or what is Alicia doing, your medical director, doing right now?
So Alicia is administering Botox for Sharon. So what it is a neuromodulator, so a muscle relaxer. So what we do is along the ways we find people get tension headaches, they have jaw clenching, of course, and then we're finding, of course, the big premonition at this point is wrinkles. So what we do is preventative Botox to eliminate the muscle pull underneath the skin. So what that does is actually softens the area, and it stops all the wrinkles from happening.
Amazing. I was going to talk to Alicia, but she's kind of busy right now. But how do you do it with, so Sharon's one of your clients. So do you have a log on what they've done in the past and being able to kind of know what they've done and work them through that process?
We do. So we have a PHIPAA compliance system, so it's privacy protected within itself. Information's never released. So what we do is when clients come in, we go through all their medical data to make sure it's medically safe for them, make sure there's no changes. We do chart to see exactly what we've done. So I know Sharon came in last 4.5 months ago, so I know exactly what plan we did, so we can move forward. Did the plan work? Is she satisfied with the results? Do we have to alter in any way? There's never any guessing. We have everything recorded every single time they come in.
Has the stigma changed with Botox?
Stigma's changed with Botox. I think there's a lot of people are very scared of Botox. I think it's overdone in most cases, especially online and Instagram, and celebrities don't look real in a sense sometimes. So a lot of time is within moderation. We do everything within moderation to make you look natural.
So whose fault is that if it's overdone?
I think it's a practitioner, realistically. So a lot of people come in with expectations. They don't have the education behind them to know that it has to be natural looking, that we can do that we don't have to look frozen or plastic, that we're just here to eliminate wrinkles, make us look a little bit softer, a little bit more refreshed. So when you go to a practitioner, the expectation is that she's going to guide you the appropriate way to make sure you look natural. If you're not getting a practitioner that's doing that, then I say there's something that maybe we have to question and revisit and maybe look at another clinic.
And that's what you really want. That's kind of the mission statement that you have with the business as a whole.
100%. We're here to make sure you look natural. We're here to address any issues that are at hand. I don't sell anything and I don't do anything that's not appropriate. If it's not medically sound, I do turn clients away. Okay. We do free consultations here.
What about young clients? Because you get people that they're young and they want to get stuff done. Yes. Where are you with that?
There is a lot of young clients coming in asking for baby Botox, it's called. So prevention. I do find baby Botox, I do not believe in it. I do get them to come in for consultations. I say if you see a line that's bothering you, that's what we're trying to alleviate. If we don't see lines, then that's something that we're gonna look at and address because we don't really need to do it. We're actually injecting things in our body. These are medical procedures. This is medication that's not needed and we're spending unnecessary money.
Good stuff. Okay. How are we doing, Alicia?
Doing good.
Wonderful.
We're just, we're injecting her forehead here. So this is a frontalis muscle. This is the only muscle that raises the eyebrows. So we generally try and keep our injections a little bit higher up so that it creates a nice, smooth, soft look, but she still has natural eyebrow movement.
How are you doing, Sharon? Good. Awesome. Thanks for helping us out. Okay, we'll take a break. We'll come back to 4th Avenue Medical Aesthetics in Hamilton that is open for business, and we'll show off a few other treatments that they have to offer. Well, good morning, everybody. Welcome back to 4th Avenue Medical Aesthetics in Hamilton, new spot that's opened up on Stone Church. And we're just kind of showing a few of the different treatments that they have to offer. We have Stephanie doing a treatment here to Misty called microneedling. And good to have Lisa Richardson with us, we're calling her a microneedling expert this morning. Good morning, Lisa. How are you?
Good, thank you.
I don't know this world at all. Maybe some of our viewers don't know it either. What is microneedling?
So microneedling, specifically skin pen, has been the first FDA and Health Canada regulated procedure to tackle any texture results. So essentially what happens is through the process of doing the needling, it's creating micro injuries that is stimulating collagen and elastin production and as well as hyaluronic acid.
So who would want to do this?
So anyone who's looking to achieve healthier skin, skin that's addressing pigmentation, fine lines, pore size, and even acne scarring. So the difference between this device and all the other ones is this has been validated as a medical treatment.
This is a medical treatment. So
yes.
We're saying microneedling, so I'm assuming what Steph has and is handling there, there's actual needles in there?
Correct. There's about 14 medical grade needles in there. That's creating over 3 million micro injuries in a 30-minute session.
Wow. Misty, how you doing?
I'm good.
You're okay?
Yeah.
Because does it hurt?
No, the technician applies a topical numbing anesthetic, and the procedure is very comfortable. As you can see, it's almost relaxing.
How does it compare to, are you choosing through different treatments? Let's say we just did a treatment on Botox. Is this the same family? Is this totally something different?
It's completely different, but the two pair very well together. So this is also, the microneedling is going to absolutely enhance any Botox treatments that you do, especially for aging and fine lines and wrinkles. and even injectables as well.
How often do you need the treatment?
So every 4 weeks is what we suggest, and we typically suggest 3 treatments. In some cases, if you're dealing with scar revision or surgical scars on the body, this device can also do, and acne scarring, sometimes you might need a few more treatments.
What about men? You seen men do it?
It's great for everybody. So all Fitzpatrick's, which is all ethnicities, men and women, and it's a really excellent device to treat anything textural that you're looking
Great,
for.
very interesting. Yeah, learning a lot of stuff here to some of the various treatments they have at the 4th Avenue Medical Aesthetics in Hamilton. Guess who's up next? It's my turn. I don't know what they're going to do to me, but we'll find out. I think it's something with lasering, so we'll get into that when we come back on Morning Live. It's my turn. Morning, everybody. Welcome back to 4th Avenue Medical Aesthetics in Hamilton. We have owner Jacqueline, who we've been talking to all day. Good morning again, Jacqueline.
Good morning.
What is Stephanie going to be doing to me here, Jacqueline?
So Stephanie's doing radio frequency. So what it is a common system that we use here with the laser machine. And what it does is it targets subcutaneous tissue and tightens the skin. So a lot of people, what they want to do is they have a lot of loose skin under the neck. We address that anywhere on the body, actually. So for me specifically, I've had children. So my skin isn't as tight on my stomach, so I get it done on my stomach. And that tightens my skin right up and decreases any little fatty deposits that I have.
Okay, Steph, how's my neck looking?
It's looking good. Could use a little bit of work.
So what is this actually doing?
So this is bringing heat to the skin. It's going to help tighten any area of the body we can do. And it's just going to push the fat through your lymphatic system, and your body will naturally dispose of it.
Like, how many treatments on my neck would I need to be doing to actually...
After even one, you'll notice a difference, but usually we sell them in packages. You can get 6 to 12.
Now, Jack, what is this machine that she's using here?
So this is Sharp Light device. So it's a trusted machine with us. We have trialed quite a few machines out. We've been using this for over 3 years and have amazing results. Patients are satisfied. Nice thing is with this treatment is there's minimal downtime. So you're a little pink when you leave for about 20 minutes to an hour, and there's no pain. It's just a heat system. So it's actually really soothing, especially right now in the wintertime.
When it comes to men with personal care, are you seeing an influx of men, or is it still kind of a full pause?
No, definitely. Lots of men are coming in. I think cosmetics and trying to improve ourselves or hit those little areas has become very common. So we do get a lot of men. Actually, everybody's really surprised how many men do walk through the door. We are very privacy protected, especially for men, because sometimes they don't want everyone to know. And we definitely don't release any information, but we do address little things for them. So yeah, we do have a vast clientele.
Well, you were saying about the privacy factor, like that, you really pride yourself in that, knowing your clients, knowing about their lives, and knowing and keeping anything that they want done.
We
to
do,
themselves.
definitely. A big thing here is with my clients, they know everything about me. I'm the lucky one that gets to socialize with all these women and men every single day. So the nice thing is that they share everything with me about what's going on with their kids. Sometimes they have a bad day, they come in and just chatting even for that half an hour while they're getting their treatment makes their day and honestly makes mine. So at the end of the day, I do feel heartfelt that I was so lucky to visit with 10, 12 people that day, for example, and that we all have really, really good relationships moving forward, which is lovely.
Yeah, because you've been doing this for how long?
Just over 5 years now.
Over 5 years, and you were down in Upper James.
I was.
And then moved up here to Stone Church.
Mm-hmm.
So it is a different area of town, but excited to meet new people around this area too.
Yes, definitely. So now that we're in a better area for location, we can actually address it. And there's other people, because there wasn't a clinic in this area. So we thought this would be a good location. It's a lot closer to my house as well, which is lovely. So I'm benefiting as well, and a lot of my patients are. So everybody's very excited.
Okay, so you're open right now, but you're kind of waiting to do the grand opening until you can have enough people in here?
We are. So grand opening right now is scheduled for March 26th between 1 and 5. So we're going to be doing giveaways. There's going to be bags for the first 50 customers, things like that. So we'll have a nice celebration then.
How am I looking, Steph?
Good.
Nice.
Nice and pink.
All right. Well, thank you so much. Congratulations on opening, Jacqueline, and 4th Avenue Medical Aesthetics, Stone Church Road East in Hamilton.